happy to welcome. Thanks, Kate. We're really happy to have the Drumheller Community Seniors Coalition with us. Amanda and Kim are here to present. We'll, following that, have some resources and FYIs, and then just the next meeting is March 25th, and we'll have a presentation from Dr. Rose Judy from Caria at that one. So yeah, just wanting to introduce Amanda Panisiak and Kim Larsen. We've been working with you guys since I think about 9 years now. And so it's been wonderful to see the work that you've done and how you've grown that in your network. And so really looking forward to kind of hearing that practical on the ground description of the work that you've been doing. So I will hand it over to you guys. Okay, thanks everybody for your patience.
All right, thank you. So this is us. We are the Drumheller Community Seniors Coalition. Amanda and I both work for the Big Country Primary Care Network. I'm a community liaison coordinator or wellness coordinator, and Amanda's a registered nurse. So yes, our coalition has been active for quite a while now. But our membership has changed a little bit over the years. So I'll kind of go through on the left, holding on to the dinosaur's jaw there. That's Karen Schneck. She works for the town of Drumheller as the Senior Services Coordinator. And she is also in charge of FCSS in the Drumheller and surrounding areas. And there's Amanda, myself, and Liza, who works for Recovery Alberta as the Seniors Outreach Nurse. So who we are, we have diverse backgrounds and we work for different organizations, but we all share a common goal and a common desire to improve the quality of life for seniors and older adults living in the Drumheller community. We've overcome a lot of adversity over the years. It hasn't always been an easy road. We've had a lot of changes, like I said, in some organization, some structure. Funding is always a huge challenge for us. But we have been able to be very creative and to really work together and look for ways to continue to offer supports and services to older adults in our community. Okay, next slide, please.
Perfect. So a little bit about our area. So about Drumheller, this is a place where we've grown up, so it is near and dear to us. It's largely known for our tourism, right? Everyone hears about Drumheller and knows about our dinosaurs, but it is supported by some agricultural and oil field sectors. Our growing, we've seen over the last 20 years probably that our population of older adults continues to grow. Some of those people are choosing to come back and retire in a place where they grew up, but we are also seeing a big push from the cities where, we have more affordable housing and it's, a little bit slower paced out here and easier to navigate. So there's a bit more of a draw for people to move this way. The challenges are, though, is that our infrastructure really isn't prepared for the amount or the volume of people coming back our way. So, housing is a never-ending battle where we don't have sufficient or adequate seniors housing. We're working hard to build some community supports and services, but we're, again, struggling to kind of keep up with demand. And again, the communication kind of between the business and the healthcare sector, we have been working in silos. So our coalition really is trying to bridge the gap between the community and our health services and the town itself. Next slide, please.
Okay, so we're going to talk a little bit about some of the programming that we've been able to run in our community and the benefits that we've seen. So the Circle of Connection program is a weekly adult day support program targeted for people living with dementia or those at high risk of social isolation. So those people that don't have support networks from family or friends built into the community. So this is 2 hours every week where we come together and I facilitate the program and we have support from volunteers and we try to target physical, social, and cognitive areas of well-being at our program. And so what we have found is people have come to this program not knowing anyone else there. Amanda has been kind of our go-to to get people connected to the program. They have rapport and trust built with Amanda because of their interactions with her at the clinic. So they're willing to try if she says it's a good idea. So Amanda will often meet them at the program for the first time to make sure that they're comfortable. They meet me and the rest of the group, and then we're generally off to the races after that. So we've worked really hard to build this into a really connected group where they can come to this group every week, where they feel like they belong, they feel like they matter, and they feel like what they contribute to the group is valued. And that has been huge for these participants. We are really working as well to kind of help encourage their health outcomes as well through this program. So we're able to learn about different things that maybe they aren't always sharing with their physician or in the clinic with Amanda. And we can really see where the gaps are in the community. So what services do they need that we just don't have? And then our coalition can take that back and try to figure out how to make it happen. One of the things with this program, so our positions are funded by the Big Country Primary Care Network. However, we don't have a source of funding for the rest. So we've worked really closely with the public library for the room. So we are able to access that room for no cost. But our supplies and all of those transportation is huge. So we have looked for grant funding. And so that's where we initially got connected with this group. And we've been able to use some of that funding to help with this program, as well as funding through Healthy Aging Alberta. And that has really been helpful because it's been consistent. So it's something that we have for a longer term, and we are able to get our participants there and get them back home after, and it's safe and reliable. Did I miss anything? No. Okay, next slide. So an offshoot of the Circle of Connection program is what's called the Memory Cafe. So this program, we had funding through the Rural Development Network for the ABCD grant, but that was short term. And so that funding ended. So what the Memory Cafe is, it's an outing-based part of the Circle of Connection program, where we go out into our local community and we access venues that our group would normally not consider going to. So places like Barney's Adventure Park, the Napier Theatre in Drumheller. We have an outing planned to the East Cooley School Museum. So places that they just don't have either the confidence, the financial means, or the accessibility on their own to go. So what we've done is we do all the legwork, we connect with the venue and the staff and kind of give them a bit of a brief on what our group is like and things that would be helpful for our group in order for it to be a successful outing. And then we go and we enjoy, and the results have been phenomenal from this group for sure. So because funding has been a bit of an issue, we did apply for an FCSS grant from our town this year. We got about a third of what we asked for. So our goal for this is for it to be completely accessible. So we aim to cover admission costs, transportation to get there, food, nutrition requirements while we're out, all of those things. So we've kind of had to really do some juggling to make it work with our existing grant fundings through connecting people as well as healthy aging. Okay. Oh, there you go.
Perfect. So our caregiver support group. So a great benefit of the weekly Circle of Connection program is that it provides respite to our caregivers. So our caregivers, for those caring for loved ones with dementia, get 2 hours once a week of respite while we have their loved one in our program. In that time, we've built in a once a month caregiver support group. So again, enabling caregivers to not only have some respite, but also to have some connection. So to come and meet with a facilitator and meet with those who have a shared understanding of their experience and what they're going through. So we meet once a month at the community facility. The facilitator position is paid for through our grant funding. So again, that money comes from the Connecting People and Community to Live Well funding. And we found that we need that facilitator position, someone to kind of guide conversations, bring resources, help troubleshoot solutions, and provide education. So it's been hugely valuable. And this group just allows, caregivers, both spouses, some are children who are caregivers, they can really share their journey, and they can, see that others are going, towards the same path or along that same path. They can talk about grief. They can talk about transitions in care and the guilt that they feel, those emotions that need to be shared and really validated, and just normalize that it's okay and normal to feel that way. So huge success. We've seen this group, continue to grow. I think on average, we're seeing 8 to 10 people a month be a part of the group. And we really hope to sustain this going forward. Next slide.
Okay, so who else do we need? So especially if we are going out into the community, we do like to have a couple of extra hands. So we've been really fortunate to kind of hand pick some volunteers from our community who are mostly retired healthcare providers who also share a passion and a love for seniors. So there's been so much value in having those not only extra hands, but extra hearts in the room. So the volunteers generally provide the snack for the day, and they are key in interacting with the participants, in making sure that everyone is engaged and able to participate regardless of their ability. We've also had some work experience students join us from a local school, which has added some intergenerational flair to the program, and it's really beneficial for both the older adults as well as the students. Last summer, we were able to work with the Badlands Community Facility runs a camp all summer. So we were able to partner with them, and we had one program where we joined their Camp BCF for an hour, and our group was able to sit at different tables with different kids and really interact. And it was kind of a wild hour, but it was really it was really, really good.
Next slide. So when we started working with the community and got our Circle of Connection program going, we knew there were more needs in our community. It wasn't just social connection and isolation. In the past couple of years, we've really noticed that food security and in-home support also has significant benefit for seniors in our community. So with the help of Healthy Aging Alberta, we were able to secure one of their grants for in-home support. And so part of that was the start of 2 meal programs. The first is our frozen meal program, where we have teamed up with Heart to Home Meals to provide once a month delivery of frozen meals to participants. We have about 15 to 20 people ordering per month. It is a subsidized program, and I want to highlight how important the subsidy is for people to be able to afford healthy, balanced meals. Without the subsidy, I would have 2 people on my program at 75%. And so what we've seen in the past just over a year of running our program is that food keeps people healthy. I can see with my work at the clinic that it improves their health. It reduces frailty. I've seen improvement in weight as far as people who had lost weight and needed to regain weight. I've seen that it lowers blood sugars for people who, have concerns with glucose tolerance. And those are valuable improvements in their medical health and their need to use the healthcare system long term. There's less need for them to see their physician. There's less need for them to go to Emerge because they have more strength and can better care for themselves. I've heard comments that, if I didn't have these meals, I would starve. Those are big words. Those are big impact words. So, unfortunately, this is our reality currently. People are choosing between buying food and paying their gas bill still. And so I think the more we can support people with their nutrition and with their in-home supports, definitely has some value long term.
Amanda, there's just a question in the chat around how do you offer the subsidy for the Heart to Home meals? Where does the funding come from? If you're able to
Yeah,
share that.
sure. The funding is from Healthy Aging Alberta, from the in-home support program grant that we received. Subsidy is based on income. So we did look at thresholds through FCSS and some of our communities near us. So like Wheatland County, we kind of took how to look at their subsidy breakdown, and it is based on income. So based what their total annual income is will determine their percentage of subsidy.
And we, the Healthy Aging Alberta funding we received in October of 2023. And so it was a multi-part program that we rolled out. And so we're going to talk about each section of that. So all of the programs really that we've mentioned have benefited from the Healthy Aging funding that we've received, which we have until the end of March this year. And then it's been extended for 2 more years after that. So the next part, oh, sorry.
I was just going to say it says thank you in the in the chat box there.
Okay, so kind of the friend to the frozen meal program is the hot meal program. So we have a business in town called Friesen Brothers, and they have a bit of a deli market there. And so we have worked with them, and they are serving hot meals 3 times a week. So people who are on this program, we have about 18 people a month. They, at the start of the month, they get a menu and they select their choices for the whole month. And Friesen Brothers supplies this for them. There's a delivery service in Drumheller called JJ Deliveries, and they have been phenomenal. So good. So they bring the hot meal right to the person's door. This is also the dual benefit of this has also been a wellness check. So Tim is the delivery driver, and he stopped to chat for a few minutes, and he kind of does a little check-in with the participant and make sure everything's kind of okay. And he has contacted us at times if he felt like something wasn't right, or if someone didn't come to their door when they normally would, or they knew he was coming. So that has kind of offered us a bit of a second benefit in just having that communication loop. And the seniors loved him. They will be home when he's coming because they love that interaction. Again, this is subsidized through the Healthy Aging Alberta program, and it is based on, again, the scale of income.
Next slide. We keep Tim busy because he also has taken on grocery delivery both in town and to our rural residents. So we really wanted to reach out to our rural communities. The frozen meal program also goes out to our outlying communities. And so we wanted to include them because we have such a significant rural population, and they often feel like the forgotten numbers in a lot of cases. So we have JJ Delivery, who will weekly pick up and deliver groceries to those in town and out in our rural areas. And this program is supporting about 10 people per month. The benefit is it's a huge relief on caregivers, whether they are a live-in spouse or whether it is children that live down the road. To know that someone can take on this task is a huge benefit. It again is that social connection and check-in, someone coming in to say, hi, how are you? It is food security, so allowing those, especially in rural, out-of-town settings, to be able to secure groceries on a regular basis. Some maybe no longer can drive, some maybe aren't comfortable driving in the winter or in the, there's so much darker hours, when it's not daylight. So that just, again, allows them to be independent and remain in their home for a little bit longer. Next slide.
So the other piece of the Healthy Aging funding we used for snow removal and yard work. So again, the whole goal is to enable aging in place. So to help people be able to remain in their home where they want to be. So a piece of that in Alberta in the winter, if you were here last week, is snow removal. So again, just those things that our older adults just are no longer able to do safely, and also alleviating that caregiver burnout from if they don't have family or neighbors or that kind of thing to help them. It does keep them safe. It reduces fall risk and all of those things. And then in the summer, it's the yard work. So the mowing the grass, that kind of thing, just again, to help them have that ability to stay in their home.
Next slide. The last piece of our in-home support program is in-home housekeeping or private in-home service. And so through Helping Hands is our private service provider, and they are under some new management, which has been really exciting to, again, have another person, kind of another ally in our community who has the same passion for caring for seniors. So I do foresee this program really to blossom and grow over the next coming months. They come in and can do light housekeeping, like, washing the floor, cleaning the bathrooms, vacuuming, dusting, kind of those day-to-day tasks, and as well as some in-home meal prep, if the preference is to make some meals at home and have them kind of fresh and ready. And again, it is a huge social piece. It is not just sweeping the floor. The care workers do a really excellent job of being able to connect and visit with the seniors in their home and provide a bit of that social connection and brighten their day, truly. So we're really happy that they are there to share resources and again, really check in with those participants and ensure that things are going well for them.
I did see a question in the chat about grocery delivery, about the fees. So so right here. So Tim looks after collecting the fee for the payment, I guess, for the groceries themselves. The fee for delivery is right now being covered by that Healthy Aging Alberta funding. Again, using income sliding scale to figure out how that works out. We are really fortunate. So Karen from the town and FCSS manages the subsidy funding piece. So the town looks after invoicing the participants for each of these programs. So that has been huge for us. Yes. Because it is a whole beast to manage all of that. So the town of Drumheller's accounting department has also been really involved in that piece of it. So generally speaking, the town will pay the provider, and then the town invoices the participant, whatever it is on that sliding scale for the subsidy difference.
And sorry,
okay.
You just were talking about Tim, and he has the ability, he's set up to be able to have them pay when he drops it off, hey? Is that what you were?
Yes. So
About
yeah,
the groceries, yeah.
The grocery, yeah. So okay. the product themselves that he is picking up, he looks after collecting payment from the participant himself. That doesn't go through us for the actual products that they get.
Right. Great. Thank you.
Okay, next slide, please. Okay, so we have really worked hard and a lot with the Connecting People group to put on a seniors fair every fall, every September. Mm-hmm. We've done 3 or 4 or 5 or something. And so what we do here is it's an opportunity for older adults in our community and surrounding areas to come together and have a day of learning. We have different speakers and presenters that come every year, and we try to base it on feedback from participants from the year before, as far as what they would like to see. Mm-hmm. So the last couple of years we've ran it where we've had an afternoon session, where we've had a dessert social. And then in the evening, we run another session with wine and cheese. And so different presenters both times. So our goal here, it's listed, inspire, connect, and share. So again, it's an opportunity for networking. It's an opportunity for resource sharing and information sharing. And again, to bring our older adults together and the people that care for them and just have a day to learn and to grow. But I think really importantly is also for them to know that there is help available, to know our contact information, to know that Karen is there from the town, to know where to go for that wayfinding and resource navigation, which is a huge, huge piece of the puzzle. So those have been really successful, and we're always looking to next year. So how are we going to change? And what we found this year was our evening session wasn't really well attended. Again, it's dark early here. And a lot of our older adults just aren't comfortable being out in the evening. So we are going to revamp for this coming September and go to perhaps like a morning light lunch and afternoon kind of a thing. We've learned a lot along the way. Knowing that, you know, presenters, if they're 30 to 45 minutes, that's kind of max, and then everyone needs a little break. So, but I think we had 75 people attend this year, so it is growing. Yeah.
Next slide. So this is a bit of a snapshot, and I know it's maybe not the easiest to see, but at our seniors fair, we had Helen help us and her team create kind of a coalition at a glance. What had we succeeded and been doing in the past year? So this is from September of last year. So a few things again have kind of changed since then or been updated and growing, but gives you an idea. We wanted people to see the value in our programs. So it's great to say numbers of people coming and that we're doing these programs, but what does that equate to in dollars per week and per month? And so as we look at kind of our Circle of Connection program, you know, as of from January to September 2024, it's, you know, almost a $26,000 value in getting participants into a program with, you know, some meaningful connection and meaningful participation and programming. You know, that's the value in what we're doing for those participants. The transportation, you know, was, you know, 264 rides, which equals, you know, $2,300 worth of transportation. That's really significant for, you know, coverage and accessibility. Our caregiver support group, you know, having 174 hours of respite for caregivers. And that's, you know, a over $6,000 value to those caregivers that we're able to provide for them. Our in-home support programs, you know, average close to $8,000 a month of meals, housekeeping, yard maintenance, all of those tasks that we're helping to provide for participants and people in our community. We did some dementia simulation training for clinic staff, which again, just that awareness and ability for them to understand when they're meeting someone who seems to be struggling, you know, why is it such a struggle and what does that actually feel like to be in their shoes? So that was of huge value. The grants that we've received, so we've talked a bit about the Connecting People and Community grant, which is a Health Canada grant. We did receive the Awareness Builds Connection in Dementia-Friendly Communities from the Rural Development Network. United Way provided some funding for meals. FCSS, Alberta Therapeutic Recreation Association, provided some funding. Healthy Aging, we have relied on for lots of our in-home support. Yeah, so those are some of our funding partners.
Okay, next slide. We're almost done, everybody. Hang in there. So we wanted to, when we received the ABCD grant from the Rural Development Network, they actually put together a video for us, which we're not going to show today, but we wanted to show some snapshots out of it. So these are the faces that tell our story. We have really worked hard and continue to work hard to improve the health and well-being of older adults in our community. They come to us to have a voice. So we are able to advocate for our older adults in our community based on the interactions and the feedback that we receive from them weekly. We can provide cost savings in healthcare dollars. So we do know that people that, I can't say across the board, but generally people that are involved in our programs are accessing healthcare services fewer times than before they were involved in our program. So that's emergency room, that's clinic visits, those kinds of things. We also have absolutely been able to show improvement in quality of life. We've been able to intervene and provide support if a crisis occurs. So if someone has a fall, and we just had a gal actually involved in our Circle of Connection program, and she fractured her ankle, and she has no supports here as far as family, social networks other than our group. So we were able to work quickly and use some of, again, those healthy aging programs to get her some supports to get her through that difficult time. Most importantly, what we hope to have proved is that collaboration and home supports provide hope. They provide hope for our older adults, hope for friendship, laughter, joy, and the ability to age where they choose. All right, last slide.
So in this slide, there is a link. That is the video. The YouTube video at the bottom is from the ABCD grant. So feel free to check it out. We do have a Facebook page, and then our emails if you want more information kind of about what we're doing, and how, again, more of how we got to be here.
Great. Thanks, you guys. That's super. I'm just going to stop sharing so that we can see everybody for having any questions, nice discussions. But what are some of the things that people are wondering about from that presentation? I know I love just seeing how it really what you're doing really builds on what already exists. So if someone's going into the home for something, then that socialization, they're there and ready to do that for people. So I see Sharon's hand up, and then there's a couple of questions in the chat, but go ahead, Sharon.
Okay, I'm just reading a report from about dementia and caring and aging in place in community, in particular for people with dementia. And what they say in it is care would benefit from long-term investments to maintain, spread, and scale. Long-term investments are needed to build awareness of, distribute and update information about initiatives and support available to people with dementia and their caregivers, and additional sustainable funding is required to find related forums, platforms, support with their co-design, and foster community building and engagement. Now, you've got a bunch of different grants doing this, and they're quite short term. So if you had a magic wand, what would you want?
Oh, oh, do you have a lot of time, Sharon?
Yes, I do.
Do you want to go?
Sure. So, I mean, of course, we would love for the province to be providing, long-term funding for these programs. We have proved time and again to them over and over with the help of Helen and her team. We have proven the value of these programs. We've proven the cost savings to our healthcare system. We have proven that it helps in solving the housing crisis to keep people at home. And so, yeah, we would love funding more than 2 years down the road. That would be hugely helpful because there is fear. And again, we have interviewed our participants. What if this funding stops? What if this program stops? How would that impact your life? And they are fearful of that day. They are so scared that they will not be able to see their friends. They'll no longer have friends. They will no longer have food security. There is a ton of risk to losing this funding for a small community, for any community.
And I think we've really seen like the key pieces are the connection. So having that group where I belong, someone calls me. So I call them every Tuesday. Someone calls me once a week to remind and encourage me to come, that someone cares that I'm there. The second piece is the food security. So if I'm having to choose between keeping my heat on or eating today, I'm probably going to keep heat. It's Alberta. It's -30 a lot of the time. Again, knowing that people are saying, look, if I didn't have this subsidy, I wouldn't have a meal. That's scary stuff. So those sorts of things, we know we are fearful of the day we can't provide that. There was a question in the chat about sustainability, and our plan right now, we have this healthy aging funding till the end of March 2027. So our plan is looking for more grants, looking for more funding opportunities. And it takes quite a bit of work, as everyone on this call I'm sure knows, to submit a grant application. It takes a lot of time, a lot of effort. And so we've learned that, if you're getting a grant for 6 months, that doesn't cut it. We need a year, 2 years. We need some sort of platform to stand on. So if we do get people on these programs and they are thriving, to have to try to pull that rug out from under them is devastating for us and them. So sustainability is really what we've been lobbying for 9 years. Showing that if we can support people in the community, it does keep them out of hospital. It does help them age in place and helps with the wait lists and long-term cares. But people cannot afford to hire these services on their own. They just can't. So that would be our wish, I guess.
Great. We've got a number of questions and comments in the chat box there. I think a few quick ones. So is there a wait list for your meal programs?
So far, we do not have a wait list. We have been able to take on all participants or all kind of requests for our programs so far. We have definitely talked at length about what do we do, what do we do when we are kind of at capacity. I think there is some flexibility because we cover multiple programs, so including the housekeeping and the yard work and the meal programs, which fluctuate in demand. So again, based on the number of people needing lawn care and meals, we have a bit of flexibility in our programming, so that so far we've been okay.
So beautiful in terms of looking at that collaboration, right? So that since it's a group that's managing all of that ebb and flow, you can use to your advantage with it. Yeah.
For sure.
So Joan Nord had just put in here, I'm curious about the transportation piece. And Joan, I'm just wondering what you'd like to know more about that transportation.
Hi. Sorry, can you hear me?
Yes,
Okay,
thanks.
yeah, I don't always have the best tech, so I'm not going to turn my camera on while
Yep.
I am filming or talking.
Yeah.
Yeah, just wondering about the volunteers and how you are managing that, because obviously I'm from Drive Happiness. We do transportation for seniors, and I know how difficult we've had with getting volunteers. And so just checking in to see how that's going for you guys, and basically just elaborating on how you are managing the volunteers part of this.
Right. So it's actually two different pieces for us. So Drumheller has a Valley bus service for transportation. So the volunteers are not involved in the transport of our participants at all. So we are able to use, again, some healthy aging funding to pay for the transport of our participants to our programs. And that goes directly to the Valley Bus Society. So our volunteers are strictly for program support, basically. And like we said at the start, we've been really fortunate in Drumheller that we've been able to kind of hand pick, again, some of those retired healthcare professionals. So I have 1 to 2 volunteers, well, 1 volunteer a week, unless we're doing an outing, in which case, and I usually try to have a couple, just for more eyes and more hands.
Super.
Hopefully that answers your question. We do know that, again, our participants generally could not attend our program if they had to pay for that transportation piece themselves. It is $14 for the round trip from their home to the program and back per day per participant. So that would be difficult and impossible for some of them to do on their own.
Yeah, for sure. So lots of congratulations on the great work that you're doing. And I think you had talked a bit about that sustainability. Pam was wondering, do you know the senior population in Drumheller currently? Do you know? I know when we were working with you, I think it was around about 30% of the population. Do you know if that's changed much?
I don't know the stats specifically. So yeah, I'd say it has increased some because we do know that over time it is definitely increasing. But yes, I'd say maybe that 30 35% would be
Yeah.
pretty accurate.
Yeah. Okay.
Mhm.
Okay. Okay. We need to advocate for this programming throughout the province. Yeah.
We've been
That's
trying
Yeah.
that's
really
that's
hard.
Exactly. Exactly.
that
Um,
survey that Lisa's put in the chat. Everyone needs to fill that out.
mhm.
Okay.
Okay. There's just one here. So you spoke about your rural clients. Can you expand on this? How far out? Kind of what's the percentage? Is it 2 or 3 major issues unique to those clients? What services of yours do they use?
So rural meaning outside of the vicinity of Drumheller. And so we include, I guess, Starland County, parts of special areas too. And so that is quite vast. If you look at Starland County, we go up to the communities of Rumsey and Rowley to the north, to Delia, Munson, Morin. So their needs are very similar to in Drumheller. It has been there. They are on our food programs, our grocery delivery, and housekeeping. So Helping Hands goes out. The only programs they don't access would be yard services. So no snow removal or yard grass cutting in the summer. But the food programs and the in-home housekeeping are definitely a need.
Thanks.
And we
Ruth
have
is,
found, oh, sorry.
no, go ahead.
If they're going to attend our Circle of Connection program or the Memory Cafe as well, they have to provide their own transportation. So we aren't able to have transport from those outlying areas into town.
Okay. Ruth is wondering, have you considered inviting your MLA to show what you were doing and the resulting return on investment there?
Oh,
Yes,
yes.
we have. So specifically with our seniors fair, because it great highlight of our program and a chance to kind of connect with all sorts of our stakeholders and partners. So yes, we have definitely reached out. We have not had them come and attend any of our programs or our events. We have definitely had seniors in our community reach out with letters and emails and phone calls to support our programs, especially when there was risk of losing some of our programs. There's been times when we've really worried about losing funding and losing staff. And so definitely we have quite a vocal group here in Drumheller. And so we definitely have made it known about our program, but for sure more calls and emails definitely are a benefit.
Super. And Ginger was just asking if you're open to other communities connecting with you, and I'll answer yes. Their emails are in the presentation, and we'll be sending out those slides. So they've been a great help to us when we've asked them for that kind of help. Oh yeah, Tina was wondering, do you have any low German seniors on your caseloads, or are there any in the area that you're aware of?
So we don't have a huge diversity in cultural diversity in Drumheller. Not to say that there is none, but for the most part, we have a mainly Caucasian population. Yeah.
Without a specific really, nothing stands out as far as that specific group, like a low German group. I can't think actually of anyone.
Yeah. Okay.
Um,
And then Lisa put in that Government of Alberta website. I did that survey. It doesn't take long to do, but great to get the community side represented within there.
Well, and I think
Okay.
too, just to kind of recap, like if it wasn't for programs such as what Helen is doing, the Connecting People and Communities for Living Well programs, to try to advocate for communities, for funding and support for older adults, it's really tough on the frontline ground level to know where to go. We definitely know the MLA, the obvious ones, right? But to try to get your voice heard up through the channels of the province, of the people that actually make those decisions, that hold the purse strings, it's really difficult to try to siphon through that and to know where to go. So we do really appreciate support from organizations through Health Canada, those sorts of things, and the work that Helen's group has done to advocate for this and to give us even a space to share our work and what would be helpful for people in the community. yeah, we're just really grateful for that.
Yeah.
And again, just those opportunities for funding are huge. We
Yeah.
can't provide service without the funds to do it.
Yeah. So I think you've kind of maybe addressed this one, but from Krista wondering about advocacy efforts, who you have approached and what was presented and what was the response. So you talked a lot about when funding was at risk and then again looking for these opportunities. You guys also presented with Healthcare Excellence Canada on your Memory Cafe, and so that was a national audience. And we've been able to when groups or when you're willing to do that kind of presentation, then we're able to share that broader also in the groups that we sit with. But anything else specifically that you wanted to talk about with the advocacy?
We also have presented a couple of times with Healthy Aging at their regional gatherings. So we did a presentation in Innisfil, and then we hosted a regional gathering here in Drumheller, and we're able to share some of our work. And so again, they've been a great group to allow us to share what we're doing and support what we're doing. And again, I know that they're, a huge part of their role is that advocacy and trying to promote the benefits of home supports and social prescribing. And yeah, they're definitely a voice for us as well.
Nice. Thank you.
We
So just
have tried to do a lot of work with the town of Drumheller as well, but we really haven't been very successful there. The industry in Drumheller is driven really largely by tourism, and the work that we're doing doesn't really involve tourism. So we've found that really difficult and challenging in our own town. Again, hoping to kind of use the town to be able to kind of push the work forward, but that really hasn't been successful for us. So yeah, we have tried the other avenues we could possibly think of, and just trying to get some momentum, trying to
yeah, and raising
show
that
people that this
profile,
matters.
right? Yeah.
Yes, exactly.
Yeah. Great. Well, and I just wanted to thank Krista for sharing your information, Krista Hammond in the chat box there from Government of Alberta with Utilities Consumer Advocate, and so they have some tools to help those with questions about their utility bills and how their free mediation team can help. So she's put her contact information in there. So we'll add that to our resources when we send out our follow-up email there. So. Yeah, so I think we've covered everything in the chat box. If I've missed something, somebody let us know there. Anything else that people would like to ask just in the last few minutes here? It's been great conversation and discussion. Thanks everybody for that.
When you guys send out your summary, Helen, will you also have that link for the survey in there?
Sure, we can do that. Yeah, for sure. Yeah, Kate's nodding. She's the one that does these screenshots and gathers all that up. So yeah, we will have all of that within there. And even if you just Google Government of Alberta, Alberta Assisted Living, have I got that? No, Assisted Living Alberta, ALA, that's right. Then I'm sure it'll pop up there too with it. So.
Perfect.
That's great. Well, thanks both of you. What wealth of information that you have to share, and what great success that you've had there. So we look forward to our continued partnership with you in doing this work. I'll just share my screen here for a minute, just to bring up just some resources that we have. Don't want to share there. Sorry, Okay, let's talk about Ageism Toolkit. It's from the Edmonton Seniors Coordinating Council. Just when I looked at it, it looked like a really good toolkit for really any organization to be able to do some actions around ageism there. Also, this CARFIT is a Canadian Association on Occupational Therapists. One of the health promotion facilitators in one of the other communities and from Barrhead let us know about that. And it's a program that helps people know what kind of adjustments they need to make to be able to drive safely. They do a bit of an assessment and that kind of thing. And then just recently found out about this Delight Dementia Wellness Canada, and it's around promoting health and well-being and being able to exercise, healthy eating. And so there are resources at that website for that. It's a program. Again, I think that came from the Stony Plain group that I heard about that one from. Oh yeah, so Thanks everyone for coming. We'll have another meeting in a month's time in March, and Dr. Rose Judy will be presenting at that time with us. So thanks again for joining, and Kim and Amanda, thanks so much for your help with today. Have a good rest of your week, everyone.